My name is Dr. John Lipham. I'm a professor and chief of surgery at USC in Los Angeles. Before we had access to TissueCypher, the only thing we really could depend on is sort of the length of the Barrett's, whether or not there was any dysplasia in there, and that really left us just treating every patient very similarly. With TissueCypher, it's allowed us to much better risk stratify those patients into the appropriate treatment that they need. Well, we took 6 previously published papers on this very topic about looking at patients with primarily non-dysplastic Barrett's that ultimately went on to progress, and found that indeed TissueCypher helped us better to risk stratify these patients than really any other clinical characteristic that we've had, including low-grade dysplasia. Well, I think when we get sort of discordant risk factors in this, obviously we're going to look at everything. I think after this meta-analysis and all the data surrounding TissueCypher, I think I'm a little bit more apt to believe the TissueCypher analysis than our traditional clinical risk factors. But nevertheless, I'm going to take everything into account. If they come back low risk on TissueCypher, but high risk on all their other clinical characteristics, that's somebody that instead of extending their surveillance out to 3 or 5 years, I may have them come back a little bit earlier than that, somewhere between maybe 1 and 3 years. So again, taking everything into account, but putting a lot more weight now on TissueCypher. Well, I think it's helping patients a lot, and really in 2 different ways. So for that patient that's been diagnosed with Barrett's, many of them are very worried about it. I mean, they lose sleep over it. They're just fixated on whether that's going to progress to cancer. When we get a result back on TissueCypher showing that their risk is low, that puts their mind at ease. They're less anxious about it, so it's helping them in that way. The other way it helps us is in the patient that's diagnosed with either intermediate or high risk on TissueCypher. That helps them make that decision that, okay, yes, I need to do something about this. I need to have that ablation to get rid of my Barrett. So it's helping them make that decision.